High blood pressure, also known as hypertension, poses a significant health concern, with potential impacts extending to heart attacks, liver damage, and kidney failure. Unsettlingly, it is often unnoticed until a certain level of damage is inflicted, as its symptoms are generally invisible and undetectable without a health check. Hypertension occurs when your blood thrusts against your artery walls with excessive force. This undue pressure can eventually lead to cardiovascular complications, as your heart and arteries are forced to work harder, potentially damaging the heart muscle over time. It may also initiate the development of minuscule tears in your artery walls, becoming potential sites for fatty plaque accumulation, a contributor to heart disease. The role of diet in managing blood pressure levels is significant, with fruit generally considered beneficial for individuals with high blood pressure. However, when it comes to fruit consumption, there are certain aspects to bear in mind, especially for hypertensive individuals. This article will delve into the 7 worst fruits for high blood pressure, including one fruit requiring careful consideration if you are on any medication. In addition, guidelines for fruit juice consumption will be outlined to help you navigate healthier options. But before we continue, we appreciate if you could lend us your support in promoting heart disease prevention. Please click on the thumbs up and share the information widely. Also, ring the bell to stay updated with our latest videos to equip yourself with the most recent info on leading a long and healthy life. The first on our list is coconut. Although it is classified as a fruit, coconuts have a high level of saturated fats that may elevate cholesterol levels in some people, subsequently affecting blood pressure negatively. Although the impacts of various types of saturated fats are under debate, many health organizations suggest limiting foods rich in these fats, especially for those already diagnosed with high blood pressure or heart disease. Products derived from coconuts, such as coconut milk and cream, often feature in high-fat dishes and desserts, possibly leading to excessive calorie intake and potential weight gain, both of which exacerbate high blood pressure. Number 2, pre-packaged fruit smoothies require cautious consumption. While whole fruits and homemade smoothies can contribute to a balanced diet, pre-packaged or store-bought smoothies are typically laden with added sugars and occasionally high levels of sodium. These additives may cause a rapid spike in blood sugar levels, contributing to elevated blood pressure. Furthermore, some pre-packaged smoothies pack a large amount of fruit, resulting in an overconsumption of natural sugars. It's crucial to remember that despite originating from fruit, such sugars can induce a sudden rise in blood sugar levels. This effect is amplified because the fiber naturally found in fruit, which moderates sugar absorption, is often broken down during the blending process. Consequently, homemade smoothies using fresh, whole fruit and vegetables without extra sweeteners are the most advisable option. Number 3. Lychees. Lychees, a tropical fruit native to Southeast Asia, can cause hypoglycemia, low blood sugar levels, when consumed in large quantities. This was highlighted in a study published in the respected Lancet journal in 2017. A sudden drop in blood sugar levels triggers your body to release adrenaline in an effort to correct the imbalance. This adrenaline surge can raise your blood pressure, creating a risky situation for individuals with pre-existing hypertension. The nutritional profile of lychees is, however, packed with a robust amount of vitamin C, B vitamins, and various beneficial plant compounds. Therefore, it's not the lychee per se that's the problem, but the quantity in which it's consumed. To avoid a rapid drop in blood sugar that can lead to a rise in blood pressure, lychees should be eaten in moderation, and ideally, they should be incorporated into meals that also contain proteins, fats, and other fibers to slow the absorption of the lychee's sugar content into your bloodstream. Number 4. Avocados. A much-loved food item for its creamy texture and versatility in recipes, avocados are excellent sources of healthy, monounsaturated fats and dietary fiber. However, they're also quite high in potassium. A medium-sized avocado contains around 975 milligrams of potassium, nearly double the potassium in a medium-sized banana. For most individuals, dietary potassium can be beneficial, as it helps lower blood pressure by balancing out the negative effects of sodium and relaxing the walls of blood vessels. However, in some people, particularly those with kidney disease or those on certain medications, like ACE inhibitors or potassium-sparing diuretics, consuming high amounts of potassium can be harmful. This condition is known as hyperkalemia, characterized by high levels of potassium in the blood, which can disturb normal heart rhythms, potentially leading to serious heart conditions. Therefore, individuals with kidney issues or those taking specific medications must monitor their intake of potassium-rich foods like avocados. Number 5. Dried figs. A popular snack, especially during the holiday season, dried figs are a concentrated source of calories and sugars. While they offer a fair amount of fiber and essential nutrients such as calcium, potassium, and magnesium, their high sugar content can cause spikes in blood sugar levels. These spikes can subsequently cause your blood pressure to rise as your body releases hormones to handle the higher sugar levels. Additionally, some manufacturers may enhance the sweetness of dried figs by adding sugars, increasing their caloric content and potential impact on blood sugar levels. If you enjoy dried figs, it's advisable to limit your intake. Check the nutrition labels for added sugars and always opt for unsweetened versions when available. Number 6. Pineapple. This tropical fruit is adored for its juicy sweetness and bromelain content, an enzyme known for its anti-inflammatory properties. However, the bromelain in pineapple can interact adversely with certain medications, including anticoagulants, blood thinners, and certain blood pressure drugs. In large quantities, bromelain might elevate the risk of abnormal bleeding in individuals taking blood thinners, according to a report from Memorial Sloan Kettering Cancer Center. Additionally, bromelain's propensity to lower blood clotting might influence blood pressure levels in some individuals, possibly causing a significant drop. Therefore, those on medication should be mindful of their pineapple consumption and seek advice from their healthcare providers. Number 7. High-sodium canned fruits. Canned fruits might appear to be a convenient alternative to fresh fruits, but they can contain high levels of sodium, especially in canned fruits like mandarin oranges or peaches, which may come in a light syrup or juice with added sodium. The American Heart Association recommends limiting sodium intake to less than 2,300 milligrams a day, and even lower at 1,500 milligrams per day for individuals with high blood pressure or heart disease. Too much sodium in your diet can lead to fluid retention and increase blood pressure, thereby stressing your heart and potentially leading to heart disease. When consuming canned fruit, it's crucial to read the nutritional labels and opt for no salt added or low sodium versions. Balanced nutrition is critical for overall health, and particularly for controlling blood pressure. While the above fruits and their potential impacts on blood pressure highlight the importance of mindful eating, they should not necessarily be considered dangerous or strictly off-limits. Instead, they should be consumed in moderation and as part of a balanced diet that also includes a variety of other fruits, vegetables, whole grains, lean proteins, and healthy fats. It is always wise to consult with a healthcare provider or a dietitian for personalized advice based on individual health conditions. Thank you for watching. Thank